Hi, my name is Ramesh Kumar. I'm a physician here in Palm Beach Gardens, and today we are here to talk about GAINSwave. This is a technology that has been around Europe for a couple of decades, and it has been used for patients with erectile dysfunction, as well as a condition called Peyronie's disease, which we'll be talking about in the next video. So let's address erectile dysfunction as one of the major hidden epidemics in our country. So people have different options. What's the most common option that people use for erectile dysfunction? Viagra, Cialis come to mind, Levitra comes to mind. But a lot of times, these medications stop working. And so when they stop working, there are a couple of reasons why it happens. So to counter that, Dr. Gaines came up with this particular technology that uses what are called shock waves. It's a non-invasive, non-surgical, painless intervention that helps clear out all the blood vessels, reformats the blood vessels in the penile area, and puts the men back into the game. So this is the machine. It's an EY machine from a company called Eclipse. And here I'm going to give you a little demo to show people on how this stuff works and how simple it is and how painless it is. So there are a couple of readings here that we program. We follow certain protocols that have been found to be effective for different levels of erectile dysfunction, from the mild to the most severe. So as you can see, we program these different levels, and all we do is numb up the patients when they come in for their appointment with a particular cream that consists of local anesthetics around the area of the penis, the scrotum, and the perineum. And we allow that to numb up the skin for a good 5 to 10 minutes. Once it's numbed up, we go in there and deliver these vibrations made out of a small bullet that fires in this little barrel going back and forth. And the impact of the bullet on the diaphragm produces those shock waves. This is how it happens. So it's programmed, and here we go. This is exactly what happens. This is the sound that people hear, and you basically move this shock wave up and down the perineal area, to the areas where the blood vessels that feed the penis are located, and the penis itself. So it takes about 20 minutes a session. We typically do about 2 sessions a week for a minimum of about 6 sessions. And for those who have much more severe dysfunction or severe ED, we go up to about 12 sessions. Now, the most common question that we get asked is, how long does this effect last? The statistics show us that about 80% plus will have the effect for about 2 years on an average. Again, it also depends on the severity of the erectile dysfunction that exists in somebody who comes in for the first time. So if somebody comes in with a mild dysfunction, the results are a whole lot better as compared to somebody who comes in with severe dysfunction. It's a little bit bad. But we do have other options that we do or perform in addition to this shockwave therapy. And that's what's called a P-shot. I had the privilege of meeting Dr. Charles Ronels, who was the inventor of the P-shot, a couple of weeks ago in Boca. And he's an incredible man, very forward-thinking. And the principle behind the P-shot is when we draw, about 10-15 cc's of blood from the man, and we spin it into a centrifuge, and we pull out what's called platelet-rich plasma, also called PRP. And we isolate that, and this is what we call literally liquid gold, because it has all the growth factors, all the nutrients, all the seeds that are necessary to create and reformat all the blood vessels, the nerves, and the valves that determine sexual function in that person. So it takes about 5 shots around the penis area. It takes about 5 minutes. Obviously there's very little pain because we numb up the patient with the local anesthetic creams, and before you know it, they're done. So we incorporate the PRP or the P shot along with the GAINSwave to get better results.